We are going to move on now to hear a case study from Northern Health, and we have two people from Northern Health presenting. Jennifer Williams, who is the board chair, and Will Halpin, who's the Associate Director of Occupational Health and Safety and Wellbeing at Northern Health. And I think Northern's been part of that group of 15 health services, so we're going to hear some of their experiences. So welcome to both Jennifer and Will.
Thanks very much, and I'll kick things off and Jennifer will finish off for us. So our case study today is addressing safety culture at Northern Health, and it's a nice segue from Marnie's earlier presentation, and the links are clear. If we look at the research around those organisations with a robust safety culture performing better and being better placed for our sector, certainly to manage the complexities of occupational violence and aggression. Our story is very much a journey. We're not completely there by any stretch, and I suppose it starts sort of prior to 2015. So what I'll present on today might resonate with a lot of the people in the room, but there is a lot of variability across the sector as well. So we know that there's some organisations that have got a lot of the things in place that I'm going to be talking about, and others that might resonate. Thank you. So as I was saying, the background for the case study I'm talking about now starts earlier than 2015. If we look at the sector at the time, the Victorian Auditor General's report was released in 2013 around OHS risk in the healthcare sector, and the following report for occupational violence and aggression for the sector was released in 2015. If we look at Northern Health at that time, the findings in those reports were consistent with what we saw at Northern Health, in that we saw an increasing OHS risk, but we had relatively low maturity when it came to managing staff health and safety. So we were poorly informed around OHS risk. Those things that we've been speaking about earlier today around lack of reporting was certainly common to us as well. And that meant that we had low engagement amongst the senior leadership group when it came to health and safety and understanding OHS risk. So if you add all those things together, what you end up with is a relatively poor health and safety culture and poor reliability when it came to OHS performance as well. So if you look at the OHS literature, there's lots of theories around safety climate or safety culture. One that I find accessible and simple and applicable for our sector is Patrick Hudson's safety culture ladder, which is on the screen there. So he describes 5 distinct safety cultures, rising from pathological through to a generative health and safety culture. So if you look at a pathological safety culture, as the name would suggest, it's characterised by low-level engagement at a senior level. It's characterised by seeing safety as a problem that's caused by workers, and really the desire is, broadly to try and not get caught. There might be a motivation to improve and an acknowledgement that things aren't great, but there's certainly low clarity around how that might be achieved. If you move on to a reactive safety culture, there's certainly a motivation to improve around health and safety, but it is done in the context of incidents occurring rather than proactively managing those incidents to occur. And then moving up the ladder from calculative through to proactive, you start to see health and safety systems develop. There's the collection of a lot of data, and there's a better appreciation at that senior level for OHS risk and monitoring and reviewing and improving OHS risk. At a proactive level, you move away from being a top-down approach and you've got worker engagement in health and safety, so really well-functioning committees and an understanding and awareness of health and safety right across the board. And that generative health and safety culture, it's really well entrenched, and the focus there is looking for problems and actively solving them. If I look at Northern Health around 2013, 2015, when this story starts, as the yellow box would suggest, I think that we were probably somewhere between a pathological and a reactive safety culture. So there was certainly motivation to improve and certainly an acknowledgement that things weren't great, but really we didn't have that clarity about how we might improve. And Hudson's safety culture ladder helps to illustrate, the roadmap to success or improvement. Whoops. So if we fast forward to 2015, in November we had Marnie and her team come and present to our board, and that was a presentation that was jointly presented by myself. You can see on the slide there, and Marnie's already spoken about the intent of the Hospital Improvement Program. In my mind, this was a real catalyst for us and a bit of a turning point. So the presentation involved the Northern Health context, but also the broader context for the whole sector. And those Auditor General recommendations were provided to us as well as the Northern Health context. So I presented the previous slide around the safety culture and where I thought we might be at, and we talked about some of the things that we might need to do and implement to improve. So the board was really receptive to this presentation, and there were some specific actions that arose out of that presentation as well. So we saw the establishment of an OHS Executive Committee following that presentation, not long after. That continues today, and it meets bi-monthly. So that's chaired by our Executive Director of People and Culture, and we've got the executive team regularly attending that, along with key decision makers. So that committee is tasked with making sure that we've got an OHS and wellbeing strategy developed and that we're actively implementing it as well. In terms of reporting, so we've boosted the metrics that we're recording and the timeframes that we're reporting on those metrics as well, and then establishing KPIs around those metrics so that we're holding ourselves accountable to improvement. Marnie spoke about lead indicators, so we introduced additional lag indicators, so those things that tell us what's already happened in terms of incidents and injuries, but also importantly lead indicators. So what are the things that we're doing proactively to drive health and safety improvement? And that's really helped to start the road to improvement for us around safety culture. One of the lead indicators that we've introduced, and I'll only talk about one, is the occupational performance metric. Oops, sorry, I'll flick through because we'll run short on time otherwise. The occupational performance metric is a tool that's been developed out of Canada, but it has been validated to the Victorian healthcare sector, specifically through the work of ISCA, the ANMF, Monash University and WorkSafe also. This is a simple tool. It's an 8-part questionnaire, and it gauges perceptions of employees, engagement with health and safety, and the way that they perceive the organisation focuses on health and safety. So it's been correlated to higher or lower, rather, measures of lost time injury frequency rates and also medical treatment injury frequency rates as well. So what we know is that those organisations that score highly on this have better outcomes when it comes to health and safety, and that it makes for a good measure of safety culture as well. So it provides a score out of 40, and any score above 30 would be seen to be an organisation that's performing relatively well in our setting in terms of safety culture. So that's an annual measure. It's a nice, simple, objective measure that we have that we would set a benchmark to and then look to improve on over time. So that's just one example of a lead indicator and quite specific to safety culture as well. I'll move on to Jennifer now to present on some of our other results.
Thanks for that, Will. Yes, so has all this recording and reported made a difference, and has it? What have we actually achieved? And as you heard from Will at the very beginning, that we see this really as an 18-month journey. There was a lot of work that was done before this, but the sort of comprehensiveness of this program really only dates back to this 18-month journey. And I would like to just acknowledge the support that we've had from WorkSafe and congratulate the work that the department's doing today, which is obviously going to help us all in better getting statistics and data that we can benchmark and compare with each other, as well as do a gap analysis against proper frameworks that are quite robust. Now remember that the literature does tell us that only about 20% of OH&S incidents are reported in the healthcare sector. So this is still very much a barrier to ensure that we are measuring the right things and that we are targeting the right things. Unless we've got the data, we can't do that. So let's just have a look at the safety culture results, the OPM, which we'll just describe to you. We have established this measure to try and identify how we can improve annually. Now, our score, hopefully you can read that, our score was 27.39 out of 40. So we are below where we would want to be by quite a long shot, actually. And you will also see up there that the staff rate a little bit lower than line managers and directors, which is not uncommon. People closer to the workplace rate things a little bit lower. So that is not a surprise to us. It has provided us with objective feedback so we can prioritise our activity for improvement of our safety culture. And you've heard today from a number of speakers that culture underpins so much of what we do here. Unless we can really impact culture, we're not going to be able to make the gains that we need to. So the main areas that we've identified improvement is further consultation, communication and input from staff regarding safety and change, and the recognition of individuals and teams that act safely and or engage in safety improvement initiatives. One of the key focus areas we've concentrated on as part of our OHS and wellbeing strategy is hazardous manual handling, and you saw what a big issue that was from the data that WorkSafe presented earlier. And if you take the risk management approach, we sought to firstly understand and then manage and then monitor this risk. First, we needed to understand the risk, and our incident and premium data tells us that manual handling related incidents are the most significant contribution to lost time, no surprise to anyone here, and the biggest driver of our workers' compensation premium. Our legislative compliance was also poor, and we've done a lot of work there, and with WorkSafe issuing improvement notices in 2015 relating to manual handling risk management. So benchmarking against industry good practice, we identified a need and a way forward for improved manual handling risk management, and we've used a similar process with occupational violence. The last point I'd like to make here is that better understanding the risk enabled us to manage the risk better. We put in place a manual handling risk coordinator in October 2016, and this led to a manual handling framework implementation. Risk assessment and incident investigation has also led to improvements in equipment as well as training. And we now need to continue to manage and monitor this to achieve improvements. So just let's have a look at the data there. The introduction of the targeted manual handling risk resourcing has seen a significant improvement in staff capability through a more robust training program, and you can see the data there. Since October 2016, our program has been enhanced and expanded to all of the labour categories across the organisation, with more than 1,400 staff trained, and that has taken us from 25% of those trained to 80%. So they are now trending down. You can see that on the bottom half of that graph now. Though the real measure of success, of course, will be a reduction in injuries to staff and workers' compensation claims, and we need at least another 12 months of data to be able to get, hopefully, some indication that things are going in the right direction there. So let's look at what we've done in improving our occupation violence and aggression. And again, here we've applied a risk management approach. To better understand the risk for occupational violence and aggression, we reviewed our OVA incident data, and we identified a growing trend of OVA, like probably everyone in the room. Across the whole of the organisation, we did that. We've also benchmarked against the sector, and we've identified opportunities for improvement, particularly regarding our training for staff in high-risk areas and in our processes for managing those patients exhibiting violent behaviours. To better manage risk associated with occupational violence and aggression, we've implemented a risk control strategy taking into consideration a variety of actions and interventions that can broadly be defined under the heading of governance, metrics, process and infrastructure, and also capability. From a governance perspective, we've implemented an OVA committee and executive sponsorship, so the leadership that you've heard a number of speakers refer to. This committee now leads our review of and improvements to our aggression management framework, and it's currently reviewing all of our policies and procedures. Have a look quickly at the premium improvement, which thankfully is going in the right direction. It obviously makes good financial sense to provide a very safe workplace despite the other multitude of reasons. So those organisations that are perceived by their staff to be safe have better rates of retention and fewer serious injuries, resulting in reduced insurance premiums. So after 2 years of capped increases in our insurance premium, you can see it going up there, a concern to the board obviously, we're starting to see an improvement with our premium forecast indicating a reduction for 17-18 from 16-17, despite an increase of 8% in remuneration in terms of Northern Health's payroll. So we could have expected to have an increase there, so something is going in the right direction. Based on our 17-18 premium simulation, our employer performance rating is expected to greatly improve from 7% poorer than like employees to 10% better performing. That's 17-18 versus 16-17. So finally, what are our future priorities for OHS into the future? This will continue to be a significant focus for the management, staff and the board at the organisation. And the executive has identified the key focus areas outlined here, some of which we've already referred to. Our OH&S and Wellbeing Action Plan is reviewed against our risk management framework, so tightly coupled there. Our OH&S metrics and broader external measures, such as the DHHS Statement of Priorities, to ensure that we're responding to emerging trends and new risks. With much hard work, the engagement of the leadership team, the board, the staff, and Northern Health, we do believe that we're going to be able to make continued improvements. But as we have said on a number of occasions, we are early on in this process, but it's very rewarding to see some early signs of progress in the right direction. So hopefully that's given you some idea about our journey, and I know that a lot of the management in this area are comparing what they're doing, and I think the toolkit that's been discussed earlier by the department is going to be a big assistance to us all. So thank you.
Thanks, Jennifer and Will. We've got time for questions again, so I'll open up to invite people to ask questions. I saw everybody busily taking notes about the survey, so I think that's generated some interest. Yes, down here, thank you.
Thank you for that good presentation. Thank you very much. So Julie Green from Alden Hospital. When I've been in the private sector and the public sector, just near misses are always an indicator of culture. So I was just wondering how you focus on that measure.
Yes, near misses, reporting of near misses would be an indicator of a good reporting culture, and unfortunately, as the stats have indicated earlier in the earlier presentations, we really only hear about the tip of the iceberg, and generally we only hear about those incidents that have caused harm rather than those that may have caused harm. Part of our strategy is to really increase the reporting culture across not just those incidents that have caused harm, but also those near misses. So we're starting to see that change, and I think the impact of the media campaign, hopefully specific to occupational violence and aggression, means we'll hear even more. Because proactively, obviously, if we're hearing about near misses, that means that we're hopefully preventing those incidents from occurring that do cause harm.
Thanks, Will. Jennifer, any comments on that?
I'll just add that I'm on other boards where near misses are regularly reported. If you've got a really good incident management system, you need to put them there because a lot of the richness of your data and what you can do really does come from those near misses. So I would certainly want to move to that situation where we could report those.
Thank you. Other questions? Anything from our regional colleagues? No, not yet. They're still with us? Good. I did notice with your manual handling that incident reports that your incidents went down, which is... But I used to always find when I sat on a board that incidents would go down and we'd think, well, that's good, and then they'd go up and we'd think, well, that's better reporting, and it's sometimes quite difficult to interpret what's happening. So did you see any rise in reporting with a focus on the area, or it looks as though it did immediately go reduce?
No, I think, I mean, as Jennifer mentioned, the reality with our measure of improvement there won't be the immediate reporting that we're seeing right now. That's all that we can provide at the moment, unfortunately. The reality is that the true measure of success will be a decrease in those incidents that have caused harm. So the lost time injuries, the workers' comp claims, which are looking like they're reducing because we are improving the competency of the workforce, but we won't know that for, that's a lag indicator, and that'll be 12 months from now. So I think, what we can concentrate on right now is more those lead indicators, so the training compliance, and, looking at the skill set of our staff also, and the equipment in particular.
Mm-hmm. And having multiple indicators, Heather, isn't it? Because not one of them can tell the whole story.
Exactly.
And some of these we can't benchmark with. So hearing that the department's going to be able to give us more indicators where we can benchmark on a larger number is fabulous, because that's what we need. We can do it in so many other areas, but in this area we can't. Yep. And I've been on other boards, for example, where the board OH&S committee spends all their time looking at about a 120-page report on individual incidents, so there is no rates or proper indicators that you can do comparison on. So I think the data is getting a lot better, but there's still improvements that we can make to get more indicators to tell the whole story.
Thanks, Jennifer. We'll just take one last question from Paul.
Thanks, Heather. Paul Butler, Alfred Health. Will, I was just wondering, how does the survey you referred to relate to the People Matters survey?
Good question. I would love to see the OPM included as part of the People Matters survey. They're separate. So we ran ours in Health and Safety Week, and we had a bit of an incentivisation around it. So there was an iPad winner, which really drove a statistically significant score and a good response rate. Which was wonderful to see. But I think a tool like this could easily be part of the People Matters survey, because it's quite simply 8 questions.
Fantastic, and it's done by a third party in the same way and reported back to the board. Okay, and is the one question around your investment in this? Your premium's going down. You've made how does the investment in resources equate to the potential for a premium reduction for insurance?
Well, to date it's certainly paid off, hasn't it? But, the amount of money that your premium can vary each year is so significant, it's very difficult to budget for those big swings that I know many of you, and I've had experience of that too. So our investment has been very modest compared with what gains we can make financially, even if you just look at a financial metric.
Fantastic. Okay, well, Will and Jennifer, thank you very much. It's a very interesting presentation. Congratulations on the work you've done. Please thank them.